Mexican health authorities are warning the country's health system could become overwhelmed by the spread of COVID-19. This week, Mexico's deputy health minister called for a voluntary 30-day isolation period and declared a national public health emergency.
This is our last chance to avoid contagion, or we cannot limit the epidemic. We do not want to live in the situation that other countries are facing.
In Brazil, concerns are growing that public health services could collapse by the end of April as the number of COVID-19 infections continues to grow. Authorities in Rio have begun repurposing schools and event spaces to tend to the most vulnerable, like the city's homeless population.
This space will be for sheltering those who accept being protected from coronavirus, because this population is the most vulnerable. In the streets, they are very exposed.
In Latin America, calls for self-isolation as the best defense against COVID-19 are intensifying. In Cuba, a lockdown is in effect until at least the end of April, and only citizens or foreign residents are being allowed into the country. All travelers arriving from abroad are sent to a quarantine center for a period of 2 weeks.
I live in the United States, but I came as soon as I saw how the problem with coronavirus was being handled, because this is my country where my family is, and I have more confidence in the public health system here than anywhere else.
At least a dozen Latin American countries have imposed mandatory quarantines to fight contagion. Authorities in Mexico, however, say they do not intend to enforce that people stay home, a policy that could change given the relaxed attitude many here have over the viral threat. Manuel, Rapalo, Jazeera, Mexico City.